As you know, most research papers begin with an introduction, which, in addition to providing a big picture view of the issue at hand, also builds up to why this study? What was missing after earlier research? What's the remaining question? For this new review by Li Zhang and colleagues, the question was, are the medications used for ADHD, attention deficit hyperactivity disorder, really free of any cardiac risk? Most are adrenergic stimulants, so can raise heart rate. Wouldn't they induce arrhythmias or even myocardial infarction? After all, the FDA labeling in the United States includes a warning on stimulant use among individuals with structural cardiac abnormalities or other serious heart problems. So, treatment guidelines generally recommend assessing cardiac risk, such as with a personal and family history of cardiovascular disease, a physical examination, and perhaps an electrocardiogram. Hi, Jim Phelps here for the Psychopharmacology Institute. Among previous meta-analyses on this question of cardiac risk for ADHD medications, older reviews tend to conclude no risk, but a larger, more recent review found an association between ADHD medications and the risk of sudden death or arrhythmia, though not for MI or stroke. Since then, there have been 13 new studies with data relevant to this risk evaluation, so Dr. Zhang and colleagues have prepared a new updated meta-analysis. This is a huge issue. According to 2022 data from the United States Centers for Disease Control, well, I'll ask you, percentage of children between 3 and 17 years old have been given the diagnosis of attention deficit disorder. Diagnosed, that is, not just symptomatic. Right, it's big, 10% here in the US. By adulthood, how many still warrant a diagnosis? Well, several worldwide studies have found a rate of persistent ADD, meaning it was present before adulthood and then continued, of around 3% of the adult population. With that big a population potentially at risk, we'd better be as certain as possible. Is there any cardiac risk from stimulant medications? This review from Zheng et al. Examines 19 data sets with a total of nearly 4 million participants from 6 countries. Well, that ought to be enough to detect even an extremely small signal. Indeed, this could be so sensitive an assay as to reveal, yes, that old concept, a statistically significant result that is not clinically significant. On the other hand, even a tiny cardiovascular risk might still be relevant. Well, depending on how you answer that question, you can interpret the results of this new meta-analysis either way. That is, overall, quote, we found no statistically significant association between ADHD medication use and cardiovascular disease among children and adolescents, young and middle-aged adults, or older adults, close quote. But now the hedging starts. First, with a comma, quote, although the confidence interval could not exclude an increased risk, close quote. That's because, as the authors make clear, heterogeneity between studies was high and significant. In other words, the results from those 19 different studies were all over the place, some suggesting risk and some even suggesting reduced risk. Well, there's more hedging around relative and absolute risk in this paper. The authors finally conclude, quote, our meta-analysis provides reassuring data on the putative cardiovascular risk with ADHD medications, end quote, comma, followed by some highly cautious caveats that actually maintain concern. So what are you supposed to do with this? Answer, follow the existing guidelines about assessing cardiovascular risk before you start a stimulant. There are not enough data to do otherwise. However, there's no new risk to report either. There, done. For more on this, I think the most interesting part is the hedging and the cautious caveats.